Hello colleague, in the last video, you explained in detail how plaques in rabbits differ from plaques in humans. It is difficult for many to understand why this is important for an ordinary person, and what exactly do you want to show with your videos?
For ordinary people, it is important to know that they can die or become disabled at any moment due to an accidental mistake that doctors and scientists made 100 years ago.
And what exactly was this error?
Early in the study of atherosclerosis, doctors and scientists came to the erroneous conclusion that plaques in animals and plaques in humans are exactly the same.
How is it that no one saw the difference between the plaques?
The problem was coloring the picture. At the beginning of the last century, doctors saw that a plaque in the form of a tube was in the artery of a person. This tube was to blame for all acute heart attacks and strokes. Doctors turned to scientists for help in studying this plaque. The scientists fed the rabbits pure cholesterol and obtained the exact same tube from them. In appearance, such a plaque was very similar to a plaque in humans. For 100 years, scientists have carefully studied plaques in animals and passed this information on to general practitioners. Therapists, in turn, actively use the results of these studies to treat people.
So everything is great. What is the problem then?
The problem is that the black and white drawings were identical.
And what's wrong with that?
The fact is that if you decorate both pictures, it will immediately become clear that the plaques are completely different. A person has a yellow plaque due to the accumulation of bad cholesterol in the lumen of the artery. And in animals, pink prevails, due to edema and inflammation of the inner layer of the artery, intima.
Yes, I remember. The entire plaque in animals is an edematous, loose inner layer of the artery, in which there are many necrotic nuclei and other elements of inflammation. Such a plaque appears in animals only after injury to the artery wall, and the appearance of severe inflammation in it.
Unlike animals, for the appearance of plaque in humans, inflammation of the artery wall is not necessary. It is only necessary to strongly compress the wall of the artery. Plaque in humans consists of only molecules of bad cholesterol glued together. Therefore, all the modern preventive measures against inflammation of the artery wall do not protect people from acute heart attacks and strokes. Plaques in humans and plaques in animals have nothing in common. Vascular surgeons know what a real plaque looks like and use that knowledge for the right treatment. At the same time, therapists are trying to apply prevention and treatment measures that are useless for a real plaque in a person.
Why are they useless?
Because they treat plaques in humans using the misconception of identity with plaques in rabbits. Over the past 100 years, no one has verified the correctness of the statement that plaques in animals and plaques in people similar to each other. Therefore, therapists do not even suspect that plaques in human arteries have completely different properties, and require a different approach to prevention and treatment. Without proper prevention, every year about 20 million people die from vascular disease. Approximately the same number become disabled.
Why are you interested in this issue?
I saw that the clinic of atherosclerosis, which we were taught at the institute, does not coincide with the clinical manifestations in patients. People smoked and were fat almost all their lives, and they were healthy at the same time. At the same time, it was enough to be very nervous, and people immediately went to the hospital. As a student, at the autopsy of a patient with an acute heart attack, I first saw real plaques. The field of this, everything fell into place for me. For more than 30 years, I have been trying to reach out to doctors and show that the results of research obtained from animals have nothing to do with people.
What needs to be done, and what can be done so that the doctors of the therapeutic profile treat correctly?
We need to tell doctors and scientists to watch the video where the real plaque is visible. And they began to treat what is in the arteries of a person's cylindrical cholesterol plaque. In my hydrodynamic theory, I have answered many difficult questions of education. Real plaque showed ways of prevention and treatment. He showed a very simple mechanism for increasing the level of bad cholesterol, showed how a plaque kills and maims in just a week of intense experience.
I have studied your article. Everything is very detailed and clearly described. I think this information will be very useful to doctors for the correct treatment of people. I hope people who care about their health and life will try to figure it out themselves, and also ask doctors to study your article. Say the most important features that are important to the average person.
Most often, a plaque appears with a strong nervous experience, with cataclysms of a personal or global scale. Nervous experiences during the war can kill without bullets and shrapnel. Earthquakes, tsunamis, terrorist attacks, and even watching football matches can cause nervous tension and plaque formation. After the destruction of the Twin Towers on September 11th in the first 2 weeks, a significant increase in the number of heart attacks among Americans was noted. The death of relatives or friends can hurt a person so much that in a few days he himself can end up either in the hospital or in the cemetery. Unfortunately, some of today's prevention measures can themselves be harmful and cause plaque in humans.
In what situation can this be?
When a person unsuccessfully tries to lose weight or quit smoking, he becomes very nervous and creates the conditions for the appearance of a plaque. The high mortality and disability from acute heart attacks and strokes is due to physicians misunderstanding what kind of plaque they are dealing with. Unfortunately, this year, in Ukraine, my best friend died of an acute heart attack. 2 years ago, another wonderful person, who himself treated patients, died of a stroke. If doctors had carried out preventive measures correctly, they could have been. I want the 20 million who could die every next year from acute heart attacks and strokes to have a chance at a happy and healthy life. Fight for your health and life. Doctors should remember that their relatives and friends, are also people, and so far they are defenseless against heart attacks and strokes. I wish everyone good health.